Welcome. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I want to thank you for joining us for this week's cross-industry update from Boulder County Public Health, helping businesses across Boulder County reopen in a safer fashion. As usual, we'll get our updates on numbers, any order updates, any information you need to hear from the county, but we're also going to offer opportunities throughout the session for you to ask questions. Please put those in the Q&A or the chat, and we'll try to get as many answered as possible. If we're not able to answer them during the session, we try to follow up afterwards with answers, either in the emails that come from me, or I try to reach out one-on-one with answers to your questions if you do leave a name in the Q&A. I'm stressing that this week because we did have a question from someone who did anonymous last week and I wasn't able to follow up. At this time, I'm going to hand it over to Jesse Rounds with Boulder County Public Health.
Thanks, Corinne. Again, if my volume goes haywire, I'm trying to fix that every week, so let me know. Thanks everyone for joining us for the weekly update, and I'll jump right in. Got quite a few slides to go over, and hopefully we'll be able to cover the epidemiological situation, our dial status, and what's coming next with that, and then also the public health order 2020-07 to get through that, and then we can talk about Q&A after that. So in terms of our situation, this is the metro area's 7-day moving average of new cases, and as you can see, we're seeing we saw the huge uptick in cases over the last couple weeks. We did see, as you can see on this, a huge drop off over the last 2 days. However, that appears to be related to the weekend, related to some recording issues. So it is lower, we believe, but it's not a huge drop off, at least the last numbers I saw. This is going back to a slide we showed a couple times last week. This is the age group and CU affiliated students or folks, and trying to compare that to the numbers in general. And as you can see, we saw a huge spike. That number was coming down last week, which is a good sign, and I think is really important to keep in mind as we talk about both our plans for the future and also the public health order that went into effect last week. Again, this is the 5-day moving average, just isolating Boulder County. Same structure, same sort of trend you saw in the 7-day moving average. Just wanted to isolate Boulder County from the rest of the area. In terms of positivity, which is one of the metrics, you can just see here, our positivity has gone up. However, it's still not a huge number. So just an important piece to keep in mind when we get to the dial. In terms of the 18 to 22-year-old age group, again, looking at the cumulative incidence of COVID-19 positive tests with all age groups in one place, and you can see that the huge spike has been in the 18 to 22-year-old age group, and that's why we focused that public health order on that group. Now, an important detail that I think we all need to think about is that recently there has been an increase in cases for all age groups. So this is all age groups without the 18 to 22-year-old age group included, and so it takes away the huge increase, and you can see a small increase in all age groups. And that is a concern. That's something we're looking at. However, it is a small increase, and I think generally we're seeing a positive trend overall for all age groups. So I want to make people aware that that's happening, but also caveat that with the fact that we do feel like this is a good trend. We're seeing good behavior and good trends in terms of positivity in general. So just wanted to include that. Our dial status, we are still under level 2 of safer at home. And to just get to that question of, okay, here are the metrics for each level. You can see, to stay at safer at home level 2, we need to have 75 to 175 per 100,000 2-week incidence, no greater than 10% positivity, and an increased a declining or stable hospitalization rate. So those are the things to keep in mind. Now to look at the county in particular, and you can see our cumulative incidence rate is much higher than 75 to 175 per 100,000. We are definitely in the stay-at-home level for that. We are still in good positivity range, which is great to know. And then also our hospitalization rates are still quite good. So what does this all mean? What happens now that we've broken one of the 3 metrics? Well, this was outlined by the state when they created the dial. On the 28th, we got in touch with the state, and we actually submitted a mitigation plan today. And then that mitigation plan will be the point of conversation between the state and the county. And if the state agrees with our plan, it is unlikely that, well, they basically said we have until October 14th to show that our plans are working, and that's what we're working on now. So we submitted a plan. And various things that have happened. The public health order is part of that plan to try and get those numbers into a place where we can stay at level 2. That's our goal, is to stay at level 2 or even move to level 1 in the near future. And we think the trends are going in that direction. But again, I wrote this slide yesterday, and I said any changes in status will be announced as far in advance as possible. That is still true, but I did want to mention that October 14th is the date we're hearing for when they would be looking at this again. So basically, we'd have 2 weeks from October 1st when they'll hopefully accept our plans. So from now until October 1st, which is tomorrow, we're going to be talking about it. But then 2 weeks from tomorrow is when any changes would occur. So we'll have plenty of time to figure out our next steps, if that's true. That was a lot of information. Happy to answer questions, happy to come back to this slide and dig into this with all of you in a moment. In terms of the public health order, couple changes from Friday when last we spoke, but basically just wanted to reiterate the public health order covers gatherings of people in the city of Boulder, people 18 to 22 in the city of Boulder. And the important change that happened after Friday was that the group size changed from greater than 1 to greater than 2. So now, if you are 18 to 22 and not under stay-at-home orders, you are allowed to go out in groups of 2. That's for safety and just being able to get to places, things like that. The residence is still under stay-at-home regulations. 37 addresses still under stay-at-home regulations. That group, and I'm not going to go into a ton of details about what that says because we did that on Friday, and we can talk about it during Q&A. But that group does have to continue to stay at home until the public health order expires on the 8th, unless it is extended. And then just the last thing, continue symptom screening. We are encouraging CU students to keep doing symptom screenings, keep getting tested, that sort of thing. So that's sort of what the public health order says overall. Some of the things we brought up last week that I just wanted to reiterate: CU students who are not under stay at home may continue to work. Those under stay at home do need to get a special dispensation from CU, and they should reach out to CU to do that. And there are only certain circumstances under which that would happen. But students between 18 and 22 are allowed to continue to work. They do not need any special dispensation to do so. Once they're at work, they don't need to be isolated. but they should wear masks, they should social distance. All of the same business operations you were doing before need to continue for those 18 to 22 as they would for anybody else. So no special treatment for those employees. Just if they're under stay-at-home, they need special distancing.
And I was just going to clarify that process is on our website. It does not go through.
Okay, I'm sorry.
It goes through Boulder County Public Health, and the application is on our website.
Okay, thank you. I misunderstood. Appreciate that. So in terms of operations, and this is something that came up last week that I think confused a lot of people, and it's understandable. You do not, as a business owner, you do not need to be IDing customers if you think they're 18 to 22. You have a right to do so. And it does not require you, the order does not require you to refuse service to 18 to 22-year-olds. We just encourage you to, if you have situations where you know that a group of 18 to 22-year-olds has a reservation or something like that, canceling those reservations, postponing them until the order has been rescinded is the smartest thing to do in this case. In terms of enforcement, if you observe a gathering of greater than 2, please call, and actually, if you see a gathering that's large, if you see a gathering of 4 people, the City of Boulder Police is unlikely to respond in a timely, they'd be unable to respond in any sort of timely fashion to deal with that. So if you see a large gathering, do call the non-emergency dispatch number. If you have questions about enforcement, definitely contact us. But I think the message we really want to get out is small groups are going to be hard to enforce against. If you put the message out that groups are not welcome, that's helpful. One of the things I think Corinne, we just got a poster, and sorry I didn't have time to put it in here, but we do have a poster that's ready to go for businesses to post with respect to this, and encourage you to put those signs up. But if you do see large groups and you can get to a phone and call right away, definitely call non-emergency dispatch. However, small groups, there really is an easy way to enforce against those smaller groups. And so we don't want you worrying about them. We don't want you, getting the police involved for a small group of people. And with that, just our general updates. We do not have a special session this week. Our Spanish language session will be recorded after this and posted, but we'll continue to have these general updates, and as we learn more about new guidance and anything related to the public health orders, we will definitely let you know. And with that, I actually, this is actually incorrect, I believe, Lane. The call center is now 9 a.m. to 5 p.m. Is that correct? Did that change?
Yeah, I think they have changed their hours. This has been a challenge to get adequate staffing, but I think we now have staffing to do 9 to 5.
Gotcha. Thank you. And then again, our email, if you feel like you've emailed Corinne way too many times, you're more than welcome to email us, and we'll get back to you. And I guess I would just say thank you for your time, everyone, and really thank you, Corinne, for helping us with all of this.
No problem. And if I can be a quick direction to a resource or answer to a question, sometimes I can't provide some of the advice, but I can get you the answer to, or a direction to a resource. We do have some questions, and I think there are some questions. So we're in Safer at Home level 2.
Mm-hmm.
And if you go back to that slide, that'd be great. So that is the current status quo. So everything up to this point, from April 30th on, all of the Safer at Home recommendations that you've been making, all of the industry-specific guidance, those are all status quo. So you still have to do employee temperature checks if it's required, health screenings, and so forth.
Absolutely, yes.
And even if we move up to level 1 or protect our neighbors, we're going to continue to do those particular aspects of the COVID, precautions,
Yeah,
even if we move along this dial.
I think that's a really good question, because I think it's really important to note that within Safer at Home and Protect Our Neighbors, what you're really changing is the capacity of public spaces, and business spaces. It's under stay at home, obviously all bets are off. That's really shutting the community down. But in these Safer at Home and Protect Our Neighbors, it's really about what's the capacity of those spaces and what's the safest level that we can have spaces open. And that's where you see the numbers fluctuate. In terms of practices, wearing masks, that's a statewide order. Remember that Boulder County has additional regulations regarding that, with outdoor mask wearing if you can't maintain 6 feet of social distancing. But in terms of practices, health checks, temperature checks, making sure that you limit the, all those sorts of things are still in place. It's just a capacity change at each of these levels.
And because we're still in level 2, offices should still be at 50% capacity. Retail should still be at that 50%. Everybody should still be meeting the capacity limits there, but you should still be doing your employee health screening. So, even if you're a retailer, your employees should still be doing their at-home or in-person health screenings. Manufacturers, personal services, all of the industries we used to break out, those are still in place, even though you're not covering them in these weekly webinars.
Yes. Yeah.
And if there are changes to those specific items, we will send them out. But when we go up and down the dial, we're just going to be talking about capacity limits at this point in time. And then those specific order changes, we will send out to the industry specific areas as they come in.
Yeah, thanks, actually, Corinne. That's a really helpful point. And I think I apologize that this focused so much on the dial and the public health order. We definitely will in the future, as we did a couple weeks ago, try to hit some of the major orders that are still in place, that it's just a good reminder. It's just I wanted to focus this week on these two.
No, and I appreciate that, especially since we've had a lot of questions about, oh my goodness, our numbers are up here and we have this dial. When are we going to have to move down? When would we have to find out? So we appreciate it. And I think that's one of the requests I put into you, was around, giving some more clarity as to when those dates would be and what the mitigation and what the state is asking of us. But I have asked Boulder County Public Health to maybe review some of the guidelines within industries and how the winter months may impact some of those guidances, maybe in, retail, how's this going to affect, that hat spin that you've always had, or some of those areas that we may have to now shift and look at because we're now entering different months or different times in seasons, and relook at those orders a little bit again.
Definitely.
Okay, so we have a lot of questions that are coming in.
Hey,
a little bit about some of the numbers that you presented, but do you have any idea of how much compliance we're seeing from those that are under the 37 properties at the stay-at-home order?
Yeah, we've not seen really any issues from our partners at the City of Boulder or CUPD. There's been very minimal activity over the weekend, very few tickets, and they were not related to kind of those specific activities. There were some, I think maybe a few instances on campus, but again, overall, very good compliance. I just wanted to also go back to the call center. It actually still is 9 to 2. There's been an effort to look at 9 to 5. I don't think that has been able to be pulled off. I think the confusion was that there's also a CU call center and it operates 10 to 5. But we're still at 9 to 2, I think, for our county call center. And if that changes, we'll make sure to blast that out. But you can always send emails, like Jesse mentioned, to our business team anytime.
Thanks for that, Lane. I knew there was some change, but yeah, glad to hear.
So again, there's the 37 properties that are at the stay-at-home, and there were, as far as that the compliance has been pretty strong in that area. I know there were Not a lot, there's not a lot of activity. I think I've heard that the Hill and some of the areas around campus were the quietest people have seen in a long time over the weekends. So, and your numbers show the decrease in in the spread of the disease among the 18 to 22-year-old. Hopefully we can keep that down. So there are a couple questions about the mitigation strategies that you submitted to CDPHE. Among those we're suspecting are the 18 to 22-year-old, the order in place for that. We know that the city of Boulder also put in an order that says no alcohol sales past 10 p.m. That was put in place on Friday. Are there any additional strategies that were put in place that people should be aware of, or what other strategies or recommendations were made to CDPHE that people should be aware of?
I don't know that there's any that impact business operations. There's a whole huge document of all the different, I think there's 25 or so strategies that are related to the different aspects of our monitoring, testing, enforcement, and containment. So there's a whole host of them. So once we get that final document, I'm not sure if that will get posted, but as far as, again, changes to orders or regulations, the ones that we've already talked about are the ones that are specific there. Certainly there are things, if people are non-compliant, there are further enforcement actions that could happen to businesses, but that's not necessarily something we want to see, but you could obviously be subject to enforcement under our orders, as well as the city can take action, including business license actions. So, but nothing that's like a new change that you need to be aware of. So it's still compliance with the things that we've been sharing.
I think there's concern that there was businesses were going to be expecting additional shutting of interior spaces or anything additional that you might be, surprising, recommending that were in there that may come up this week or next.
No, we wouldn't have any surprise announcements in there.
Okay. While we see an increase in 18 to 22-year-olds, and you mentioned other age groups, how much of an increase is in older adults? Is it due to changes in weather? Is it because there's been people are just not taking it as seriously in the other age areas? Why do you think we're seeing an increase in some of the other age groups besides 18 to 22-year-olds?
Yeah, Lane, I don't know if you have any specific guidance. I think it's too early to tell exactly what's that.
No, we know that I think the predominant way people are getting sick is from those close contacts. So people that are around someone who's sick and then they become sick themselves, that's one of the biggest, certainly at employment. So if there's someone sick at work, again, another opportunity for close contact. Those are certainly big ways. We've seen some travel instance. So people that are traveling abroad and again, putting themselves in those positions where they're in larger groups to get potential exposure. But the likelihood is not social distancing, not wearing masks. But as far as specific, outbreaks where those demographics were at, we haven't identified any specific issues. Again, I think it's probably a mix. Most people, it's hard for them to really identify a specific exposure.
And I know that we're probably all going through a little bit of a COVID fatigue, and I'm feeling it. We're 111 webinars in, and we're all going through it a little bit. But how important is it for us to continue, especially right now, to continue to follow these protocols as businesses and as individuals in our community to prevent the spread of this disease?
Yeah, it's essential. I mean, we know Jesse showed all the metrics. It only takes one metric to move you to that level. So we're potentially at stay at home based on where our numbers are at. So again, if we see more illness over the next 2 weeks, especially in areas that are outside of the CEU focus, we're in big jeopardy of moving. And stay at home means businesses in a large part are closed. So we do not want to see that happen. So it's really incumbent on everyone to make sure we can control what we can control.
And I think to add to that, I actually really think that what we saw before this most recent outbreak, we saw weeks and weeks of really good numbers. And I think that that was down to everyone following the guidance. By and large, the community is doing what they should. And I don't even, I don't, placing blame on the students is not valuable. I think that the public health order is not intended to place blame. It's trying to protect the community. It's trying to help the students, that sort of thing. But really, what I think you can learn from the spike that seems to be related to parties versus what was happening before that is that if we follow the guidance, if we behave appropriately, we can help control this. It's when we start to slip, when we start to think it's not a big deal anymore, that we start to see problems. And so to reiterate what Lane said, I think we just need to stick with what we're doing.
Okay. Can you go back to your the slide that had the green 18 to 22-year-old line and the orange 18 to 22-year-old group?
Sure.
Let's go back a couple. There you go. So that's the 18 to 19 and the 18 to 22-year-old. It's just showing that the incidence between the 18 to 19 and 18 to 22. I think someone just wanted to see that slide again. They just wanted to know the difference between the two lines, and I think just showing that the green line is 18 to 19 and then the orange line is 18 to 22. So showing that there is a high number in that 18 to 19 range.
Yeah, that's okay. Even more problematic within that 4-year demographic or so. That 18 to 19 is even worse.
Yeah.
Okay. So some people are planning holiday travel, whether it's from Thanksgiving or Christmas. I know employees are planning some travel. Are there any best practices for return to work post-travel in any of the industries?
It's the same piece as Jesse mentioned, that you need to do your employee screening. So if you've been in any exposure incidents where you've been around someone who has COVID, then yes, you need to quarantine. Outside of that, it's still just the symptom screenings. So that being said, certainly making sure as you do travel that you're minimizing your exposures, definitely wearing masks or even respirators, So again, ensuring that you're protecting yourself and not putting yourself into situations where you can get ill. Also know that we're heading into flu season, so certainly at Thanksgiving we'll be in flu season, so there's going to be other respiratory diseases out there as well.
And we're past October 1st, so the recommendation is to get the flu shots to make sure that there are flu shot clinics out there. So that was one of the recommendations out there. Speaking of symptom screening, I know there was a question last week that we had to get clarification on, and it's because the state has on their symptom screening document, it says to exclude staff until they're fever-free without medication for 24 hours and 10 days have passed since their first symptom, unless they have a clear alternative diagnosis from a medical provider, if they check yes to any of the symptoms. And Lane, you asked that question. You got a little bit more clarification on that question, and are you okay with me kind of listing the clarification on that?
Yeah, please do, because I think there's a huge list of symptoms, and so there's sort of priority symptoms and then sort of auxiliary symptoms that are common amongst a million things. So a headache or fatigue or something like that. Those are the only symptoms. I mean, there's a lot of reasons you could have a headache, and it doesn't mean that you for sure have COVID. So we're looking at sort of 2 symptoms when it's some of those nondescript, but a fever obviously by itself is enough of a risk. But yes, you can share that.
And I think the fear was that employees would stop saying, yes, I have fatigue or I had a headache, because they'd have to stay home for 10 days. So the advice that's being given is that if you have one or more major symptom, like a fever, chills, new loss of taste or smell, new cough, or difficulty breathing, or 2 of the lower risk minor symptoms, sore throat, runny nose, muscle or body aches, fatigue, headache, or some of those, then you follow that guidance of the 10 days, and so forth. So I will send that out. We got a little bit more clarification on that, just because, again, there was a little concern that was brought up on last week's call about that. And then as we enter into flu season, again, somebody has a fever. I mean, there's a lot of illnesses. If they have a fever, they should stay home. There are a lot of reasons that people should stay home. Getting a little bit more clarification for you from last week. And again, the person who asked the question last week, you asked it as an anonymous, so I wasn't able to follow up with you directly.
And I think the other important piece is alternate diagnosis doesn't necessarily mean you have to go to a doctor to get your headache diagnosed. So, or runny nose, you have seasonal allergies or some other allergies that can explain your symptom. That I think is something you need to make sure you're bringing to bear. But again, multiple symptoms that are not already part of some other underlying condition are what we're really concerned about.
Okay. All right. There was a question about whether liquor licenses have been extended to the end of October for the extended outdoor patios. And I just got clarification and confirmation that is the case. So if there are extended, if there are outdoor patios that are extended, a lot of them were extended till October 31st, that is a municipality, that the liquor licensing has been extended as well. So now there are different municipalities that are looking at extensions beyond that October 31st. I know that City of Denver did an announcement that they're that they're looking at different options throughout the next year. Fort Collins had an announcement, some others had announcements. Those are municipality run decisions, and those are the types of things that different municipalities are looking at as we enter into the winter months. Sorry about that. All right, so this individual says their company does a lot of work on the Hill during this time of year in occupied properties with students. How do you recommend we enter these homes to do work? Any special precautions?
Sorry, Lane, go ahead.
So I was just going to say, if this is like field services, we just want you to follow the guidance per your sector. So again, minimizing the amount of people that are around, certainly social distancing, wearing masks, cleaning, high touch services, those things. But without knowing the specific kind of focus of the work, can't give a whole lot more detail.
Yeah, and I would add, for those addresses that have stay-at-home orders, if you are a contracted cleaning service or whatever, those are allowed. I would check the order for details on that. But yeah, Lane, I think you're exactly right. Like, follow the guidance for your sector.
And for clarification, the 37 addresses are posted under the order on the county website as well as the city website.
Yeah. Yeah.
Okay. All right, there's a couple questions about Safer at Home Level 3. So it might be useful for you to actually bring up the chart that shows the difference between the levels.
I will see if I can pull that up. Give me a moment.
So I think there's questions. I think it would just be useful to look at it, because I think looking at where we go from if we go from level 2 to level 3, what that means, whether you're a recreation center or an office or a restaurant, what that really means would be good.
Yeah. Let me get to the dial here.
And I know there were news stories out recently about how we've seen a little bit of an increase. While you're bringing that up, maybe Elaine, you can answer this one. There has been an increase in the older populations above the 18 to 22. Has it been a large increase, or has it just been we've seen just increases in all age areas?
We were at pretty low levels, so percentage-wise, some of the increases, percentages are a little larger. But yeah, I think we've seen increases really across the spectrum. I think not just in Boulder County, I think in metro area. So it is something that we're paying very close attention to. We're not at sort of the same outbreak level we saw with CU, but we are very much monitoring it to see if these trends are just the beginning or just a blip, a beginning of something worse.
And I actually heard from a coworker that her sister, by visiting Colorado, is now having to quarantine for 2 weeks. So Colorado, for some states, is on the quarantine list because of increases in Colorado. For other states, because we've seen increases, but just like we had that for other states earlier in the year. Jesse, we're still seeing your PowerPoint, so if you're showing another place, you're gonna have to unshare and reshare.
All right, let me see what I can do here. New share.
All right, there we go.
All right, perfect.
So if you look at this, and if you want to kind of run through, so this is on the Boulder County website. The link that we send out as far as being able to track where we are in the dial. This kind of gives you that idea that we are, you know, the differences in the dial really impact the capacities. So go ahead and you can just kind of give some examples. And I think recreation is where the question came in.
Okay.
So if you could pinpoint that one, but then show some others.
Sure. So just to sort of orient you, the fifth column is the Safer at Home level 3. We are in the fourth column, and you can see, you know, gyms and fitness are a place where you're seeing a lot of change from 25% capacity to virtual or only outdoor classes, and that's a pretty significant change. In terms of, I mean, generally in terms of indoor spaces, we're going from 50% capacity to 25% capacity. And then in anything where there's a lot of like gyms or camps or things like that, you're going to virtual. And that actually also, you know, that affects places of worship as well, where you'll go from 50% capacity or 50 people, whichever is fewer, to 25% capacity or 50 people, whichever is fewer. So that could be a huge impact for places of worship. In terms of non-critical manufacturing, you know, we were up at 50% now. It'll go back down to 25%. There are some pretty big changes that would need to occur in terms of capacity, but in terms of practice, no change.
Okay, I'm gonna post the link to the Boulder County site in the page. Some people's screens are really small, so they can't see, but I will post, I'm gonna post it to everybody, not just you guys. I'm gonna post to everybody the link to this, but as you can see, this is why in the next 2 weeks, we wanna get that number down. The mitigation strategies that you submitted, we wanna get the numbers down because we'd like to stay in level 2, and our goal is to move up the dial.
And I shared the link to the state. It has the whole dial document that walks through all of it, right, which includes that chart that Jesse was showing.
I'll try to make this a little bit larger. I saw one of the comments on here.
So in the case of, you know, gyms and fitness, I think the question was there, you know, going from where we currently have that 25% capacity or 50 people, going back to virtual or, you know, personal training again, or the outdoor, you know, the groups of outdoor in groups of less than 10. It's a big change.
Yeah. Yeah.
Okay. All right. So Lisa, you asked if they could show the operations information again. If you could clarify what you meant by that.
Oh, I got here.
Okay.
I'll just switch over here.
Okay, perfect.
Let me see here.
And while they're doing that, are there any other questions for Lane or Jesse? We're on your presentation. I can see your presentation.
Slide. Uh-oh, all of my secret notes.
Yeah, we can see your super secret notes. There are no notes, but they're super secret.
Here, let me just share this and I will.
There we go. There we go.
Yeah. So just a remind, you know, this was really focused on what the order requires of businesses, and I think the important thing is we are not the order does not require that businesses refuse service. If you suspect a group of 7 or 8 people of including it, even one 18 to 22-year-old, that is a thing you could ask for IDs for, but you are not required to do that under the order. What we're really looking for is those large groups, and trying to stop that from occurring.
This is City of Boulder. This is a City of Boulder
Yes,
order.
sorry, that's really
Lisa
important.
is in Longmont, so businesses in other cities, this is not necessarily applicable to them. Although we have gotten questions from businesses in other cities that have said, well, what if we start seeing 18 to 22-year-olds coming into our businesses and meeting in groups there? So what should they do?
So, I mean, there is no prohibition against that. If I think one of the things that was a concern last week was, what if people decide, okay, they're not going to let us have parties in Boulder, we're going to have parties in Lafayette or Longmont. And I'm not aware of any uptick in that. But there, in the other parts of the county, there is no prohibition against 18 to 22-year-olds gathering. The one caveat to that is, we're interested if obviously we see a large group of young people from Boulder choosing to go to other places to party. That's, again, it's not prohibited, but it's something we'd want to be aware of.
And just to clarify, so all the things Jesse's saying, so the businesses are not held accountable. There aren't requirements for 18 to 22-year-olds outside of Boulder. That being said, all the CU students are subject to this requirement. So their code of conduct requires that they comply with the order. So if they are going to other areas of the community or outside of our community, we've heard anecdotal reports of students going up to the mountains for the weekend and things like that. So those are still issues. Those are things that they can be cited for under code of conduct. So if you do suspect, the issue would be you need to report that to CU's code of conduct, but they would need the specific names, so they can't just get a report of, we think there were 4 students here in Lafayette. That's not going to do anything for enforcement.
Nope. All right. So just to be clear, we're in level 2. So right now we're in safer at home level 2. The reason we were showing level 3 is because, will you go back to the numbers slide? Yep. You show where our current numbers are?
Absolutely.
And just to be clear, we put in our mitigation plan today. That'll be reviewed with the state tomorrow, and we are anticipating we will stay in level 2. We believe that they will approve our plan and that we have addressed through strategies and have 2 weeks to comply. We will find out that certainty tomorrow, but that's what we're expecting.
So currently we are in the yellow level as our current status, but our numbers, because our numbers put us out of that range, there is that fear that we could drop down, which is why we were showing what the ramifications of dropping down look like, and why Boulder County had to submit a mitigation plan to CDPHE for hopes that we have until October 14th to get that 442.6 back down below 175.
And again, I think all the metrics are still relevant. So I think the fact that we only have one that's significantly out of compliance also weighs in our favor. If we saw 3 things in the red, that would be a much more difficult dialogue and plan to address not changing status. So again, we want to keep everything that's already positive, and we want to knock down those numbers. So again, hopefully the trend has already started. So hopefully in the next 2 weeks that will continue.
So if we hear any differently, we will let people know. We should have more certainty in the next week's call. If anything comes up that is like we did last week, if something comes up that's kind of an emergency order, or we didn't know this was coming, we will try to continue to put on sessions to create more clarification. If you have questions in between now and the next call, please ask them. We did have a couple of very specific questions, very specific to certain industries. I didn't ask them because they wouldn't apply to anybody but maybe you on this call. So we'll follow up in outside of this call with the answers to those specific questions. I'm going to do one last call for questions on the Q&A or chat, because every time I say I'm about to close it, we get another question in. In the meantime, I want to thank Lane and Jesse, partners in continuing to offer these sessions to answer questions. I want to thank the businesses who continue to ask the questions, to continue to partner with us as we move forward in this. And while I say I have COVID fatigue, I don't have fatigue in helping businesses, find the answers to the questions. I know all of us partners want to continue to help businesses thrive, for our health and for our economy, and we want to continue to find the right resources and all the answers to your questions so that you can continue to operate in a safe fashion. All right, no questions. We'll see you all. Hopefully, we'll see you all next. Oh, hold on. Are there any exceptions granted to outdoor events? For example, a high school football game at a large stadium is limited to 175 under your plan. Can that change?
Right now, the only way it's going to change is to get more restrictive. So it's not likely to get less restrictive for any time soon. So that's going to definitely be the maximum for the next 2 weeks, and then we'll see where we're at the end of that, of whether there's any opportunity for that to be more flexible. But that certainly will not happen for at least 2 weeks. Okay.
So we're in status quo for right now. And if any changes come in for specific industries, we'll send out specific industry level communications. All right. Thank you both. We'll see you next week.
Thanks,
Corinne. Thanks, Lane. Thanks, everybody.